The Healthy Athletes Program, a partnership between the Special Olympics and Health One Global. Special Olympics was founded in 1968 by Eunice Kennedy Shriver as an international nonprofit organization. This organization would be dedicated to empowering individuals with intellectual disabilities through sports training and competition. Special Olympics is now the world's largest amateur sports organization with over 3.2 million athletes. Those athletes come from over 170 countries, participating in over 30,000 events each year. Each athlete is afforded the opportunity to participate in the local, regional, and national levels, culminating in the Winter and Summer World Games every 4 years respectively. For the past 12 years, alongside its sporting activities, Special Olympics has run a global program called Healthy Athletes. This program aims to provide a free healthcare screening for all athletes at the largest 800 Special Olympics games held worldwide each year. For the past 7 of those years, Health One Global has been the exclusive Special Olympics Healthy Athletes global partner for electronic health records. As a partner in this mission, Health One Global provides and manages the Healthy Athlete software in use by Special Olympics programs worldwide. Special Olympics has used this software to record healthy athlete screenings in a single global database. This has created for Special Olympics the world's largest, richest, and most comprehensive database on the health parameters of people with intellectual disability. This makes Special Olympics unique. No other organization in the world offers free healthcare screening services to a population of over 3.2 million individuals from over 170 countries. To date, there is no other healthcare organization that has registered membership of this magnitude. There is no other healthcare organization collecting healthcare data on individuals with intellectual disability into a single global database. The data collected through the Healthy Athletes program has repeatedly demonstrated beyond doubt that citizens with intellectual disability have significant unmet healthcare needs and poor access to healthcare in every country around the world. For example, at the Special Olympics World Summer Games in Shanghai in October of 2007, data on over 4,800 athletes from over 150 countries worldwide were collected in the Healthy Athletes software. During this time, the data for over 18,000 screening sessions over a period of 8 days were collected and turned up some astonishing results. This is the largest, most diverse, and comprehensive survey of the health status and the needs of people with intellectual disabilities ever conducted. Sadly, these are the typical figures found at every one of the 800 Healthy Athlete screening events held worldwide each year. The Healthy Athletes program has repeatedly proven beyond all doubt that citizens with intellectual disability have significant unmet healthcare needs and poor access to healthcare. In part, this is due to conditions associated with learning disabilities. For example, half of all people with Down syndrome have congenital heart problems. People with learning disabilities are also at higher risk than the general population for cancer and gastrointestinal problems, as well as conditions associated with cerebral palsy, epilepsy, mental health, and Alzheimer's. Special Olympics uses the data from the Healthy Athlete software database to advocate better healthcare for people with intellectual disabilities around the world. The Healthy Athletes program aims to draw the world's attention to the unmet needs of people with intellectual disabilities and to convince legislators to change the laws to meet the needs of people with intellectual disabilities. Special Olympics also recognizes the huge research value of the data in its Healthy Athletes database. For example, one of the Healthy Athlete screening tests is for bone density. At a recent conference in the United States, findings were presented on the bone density results of 4,000 athletes from around the world. Few, if any, other organizations have this data in these numbers and from around the world. Increasingly, organizations from the outside are recognizing the immense value and research opportunities available through this global data by working with Special Olympics. The data is now accumulating at an ever-increasing pace. Over 90,000 new screenings were carried out and added to the database in 2009 from 47 US states and from every continent in the world. Perhaps more importantly, even more will be added in 2010. However, knowing these facts is no longer enough. Special Olympics needs to act to improve dramatically the health of its athletes. Fundamental to excellent healthcare is excellent information, and that means information to empower healthcare professionals and, above all, information to empower the athletes themselves.
For me, the personal health record would mean that I could encourage my daughter to go see her healthcare professionals alone. Knowing that they would have access to her medical history, her past treatment, her current medications, and her allergies makes me feel at ease. It would also make her feel so much more independent. I, on the other hand, would have the assurance that when she came home, we could look through the healthcare professional's consultation together to figure out the next steps.
With the Electronic Athlete's Personal Health Record, Special Olympics seeks to improve forever the health status of its athletes and, through them, inspire every citizen with intellectual disability to improve their health too. Health One Global is proud and honored to work with Special Olympics, the athletes, and their caregivers towards this mission.